Back now with my conversation with Dr. Anthony Fauci and chair of the Congressional Hispanic Caucus, Congressman Ruiz, who is also an emergency room physician. We began by talking about vaccinations and the projected plateau in enthusiasm. The Kaiser Family Foundation released a report this week. It said the tipping point on vaccine enthusiasm would arrive in the next 2 to 4 weeks, and encouraging vaccinations will be harder after that. How concerned are you that slowing vaccine demand could give these new variants an opportunity to continue to mutate, spread, and prolong our return to normal?
Well, I believe that if we continue to get the facts and the information to the American public about why they should get vaccinated, that we will see a continual steady stream of people getting vaccinated. What we have is we have the capability now with the community core, the COVID-19 community core, of getting trusted messengers in society. They could be athletic heroes, they could be entertainers, and importantly, members of the clergy, to give them the information to go forth and explain to people why it's important not only for their own safety, and I think there's this misperception that because you're young, there's no chance of you getting a serious outcome. That's not the case, particularly with the variant that's dominant now, the 117. The vaccine works very, very well against that variant. But in the unvaccinated situation, that variant can spread very rapidly and also infect young people more so than the previous strain of the virus that was circulating. So we're going to be trying our best to communicate with the people to make sure that they understand it's good not only for themselves, but they really should understand that you should have a responsibility to society. Because if you were young and got infected and you have no symptoms at all, you would say, well, who cares? I have no symptoms. But you should care, because if you get infected, you may inadvertently and innocently pass it on to someone else, who might pass it on to someone else who really could get sick, perhaps go to the hospital, and perhaps die. So you have a responsibility to yourself for your own health, but also a societal responsibility to not be part of the spread of this virus, but to be a part of the solution to the outbreak.
Dr. Fauci, you've estimated that somewhere between 70% and 85% of the country needs to be immunized before we reach herd immunity. Right now, the CDC data shows that a little over a quarter of the population is fully vaccinated. How much more work do we as a country have to do to convince the public that it is in all of our best interests to get vaccinated?
Well, first of all, 50% of the population, the adult population, has received at least one dose. And it is really important, as you're pointing out, that we put everything we can into getting people to appreciate why we need to get the overwhelming majority of the people vaccinated in order to see a dramatic downturn of the curve of new infections. Right now, we are at a disturbing level of an average, a 7-day average, of about 60,000 new infections per day. That's unacceptably high because it's disease burden, hospital burden, but also it's a risk that you may get a surge even further upward. We absolutely need to avoid that, and we will definitely avoid it if we get more and more people vaccinated. So every day, 3 million people additionally get vaccinated. So if you're looking at it as a race between the virus and the variants and getting people vaccinated, if we can keep that flow of about 3 million people a day getting vaccinated, that race will without a doubt, would definitely be won by the vaccine.
Dr. Fauci, federal health authorities say it is time to resume use of the Johnson & Johnson coronavirus vaccine. The CDC met with an advisory board about it Friday. What would you say to people who are now hesitant to get the J&J vaccine?
Well, the J&J vaccine is clearly a highly efficacious vaccine. And I think the pause, which some people may have taken as a real concern, the pause should underscore how seriously we take safety, because the risk of this is extremely low, a very, very low risk of this adverse event. And the fact that the CDC and the FDA originally paused this should underscore to everyone that we take safety very, very seriously. So when a vaccine is let out again to be able to be vaccinating people in this country, you can rest assured that that's a safe and efficacious vaccine.
I want to bring in Representative Raul Ruiz into the conversation. He's the chair of the Congressional Hispanic Caucus. Congressman Ruiz is also an emergency physician. Congressman, one of the scariest things about this virus is the symptoms that so-called long haulers deal with long term. We still need so much more data about the ways that different communities have been affected, especially in the long term. But given the early estimates, about 10% of those who get COVID have long-term complications. What does that mean then in terms of accessing things like disability services? And what does it mean for undocumented members of our community who aren't eligible for those services?
The first thing that comes to mind is that is why it is so very, very important to get vaccinated, even if you're young. In fact, those that are long haulers tend to be younger, healthier to begin with, young athletes. I've known several who, after 3 or 4 months, continue to require oxygen, need to use inhalers, cannot exercise as much as before, continue to have headaches, confusion, or what they call these brain fog situations where they're just not feeling up to par. And so the most important thing is to get vaccinated so you can prevent getting it. And in addition, to ensure that individuals who cannot work, like any individuals who cannot work, needs to make sure that they speak with their physician so that they can apply for disability and for some extra assistance from your local county, state, and federal governments. In terms of immigrants, unfortunately, currently our undocumented individuals oftentimes are denied certain life supporting services from our government, and that's why we just simply need to rectify that with comprehensive immigration reform in the United States Citizenship Act and get that passed. But note that the vaccines cannot be denied based on immigration status. Furthermore, there are social services like meal program, nutrition programs in schools, in the community that are distributed without regard to immigration status that individuals can apply for. It's also important that to note that in certain states, like in California, individuals who lack Social Security numbers can apply for the Medi-Cal program, which is the Medicaid program, and get health care through there, as well as the federal qualified health centers or your community clinics that are oftentimes located in underserved areas, and they are also another source of care.
Congressman Ruiz, in April 2020, Latina unemployment hit 20%, the highest rate of any group. 1 in 3 Latinas have not recovered from the recession. Roughly 900,000 are out of work. What more needs to be done, both to level the playing field moving forward and to account for the loss that was endured by this community?
That is absolutely correct. Latinas have taken the brunt of the pandemic more than other women workers compared to white women, et cetera, because of the conditions in which they live in underserved, under-resourced communities, and because oftentimes they had to have stayed home and do not have the job flexibility to work from home. So they either had to choose staying home with their children who couldn't go to school or having to leave them behind in an environment where there were no child care support. So one of the things we need to do to help our middle-class families and Latino families is to make permanent the child tax credit that was augmented in the American Rescue Plan. It increased the child tax credit for families. That increase is going to relieve 2 million Hispanic kids out of poverty, which is an incredible accomplishment. We need to make that permanent, including the increase in the earned income tax credit. And we also need to have 10 years of mandatory child care subsidies so that Latinas can get the assistance to have child care and they can get back into the workforce and help their family have social mobility and have financial stability.
Next, Dr. Fauci and Congressman Ruiz answer your questions about the pandemic and the vaccine. We are back with that after this. We're back now with Dr. Anthony Fauci and Representative Raul Ruiz answering your questions about the COVID pandemic. Dr. Fauci, this question comes from Janet Murguia, President and CEO of Unidos US, the nation's largest civil rights organization for Latinos. Take a listen.
For Latinos and so many Americans, family time together has been among the top missed moments during the pandemic. As we experience summer weather and more vaccinated individuals, Latino families will want to take advantage to gather and reconnect. But top of mind is, how can individuals protect themselves from new variants?
Fauci, a question there about new variants.
Well, the variant that is in the United States right now that's dominant is called the B.1.1.7, which originated in the UK. The vaccines, all three of the ones that we have now currently available to us, the Moderna, the Pfizer, and the J&J, work very well against the 1.1.7. There are other variants that are around. For example, there's one in New York City, a 526 variant, which more recent studies have indicated that although the protection is diminished somewhat, not enough to really be of great concern, the vaccines still protect against that variant. So what I would tell to the individual is that enjoy the warmer months with your family. If you get vaccinated, you will be protected against the original virus as well as the major circulating variants right now. Another good reason for everyone who can possibly do that to get vaccinated as quickly as you can.
Congressman, the Georgia Latino Alliance for Human Rights shared this question. Community organizer Giovanni Serrano asks this.
We have received many complaints, community members who have been denied the right to a vaccination because of the lack of an ID or because of the legal status. So my question is, how are we making sure that low income, homeless, and undocumented people are not being excluded from vaccination in the state of Georgia as well as in the country?
Congressman, this question about equity and access to the vaccine, especially a question around immigration status and access, it was one we received a lot.
That is a very important question, and let me be very clear to everybody who's watching that vaccines are being distributed, allocated, and administered to everyone free of charge, as well as without regard to immigration status. So that is the current law that was codified in the CARES Act, as well in the American Rescue Plan, and that is the intent of the administration. So if anybody's experiencing any type of discrimination of getting the vaccine because of their immigration status, please inform your congressperson or the federal agencies involved. Look, equity is so important. Equity is not a matter of a theoretical social justice. Equity is a public health scientific approach that will end this pandemic as quickly and safely as possible for everyone. Because if you target the vaccines to the hardest hit, highest risk individuals to get infected and infect others or who will die from this pandemic, then if you target them first with the resources needed to keep them safe, with prioritizing their risk, then you're going to end this pandemic and prevent the spread of this disease to everybody in all communities. And that's why equity is so important.
Dr. Fauci, this question is from Patrick Robles, a Chicano activist and a sophomore at the University of Arizona.
Can you gather safely with vaccinated family members who don't live in your household without masks, even though you have a kid in the household who is not vaccinated at all?
Definitely yes, no doubt about that. As long as the child is a child that doesn't have an underlying condition that would make that child highly susceptible to a severe outcome. If it's a healthy child, the answer to the question is yes, you can gather in the household. You don't need to wear a mask if you're vaccinated, and you could have physical contact. Typical example of a grandmother wanting to come in, see the daughter and the granddaughter. If the grandmother is vaccinated, and even if the daughter and the child, who obviously won't be vaccinated, you can gather indoors. You don't have to wear a mask, and you can have physical contact like a big hug to your granddaughter.
It makes me so happy how many of these questions are about getting back together with our family. Representative Ruiz, NBC News correspondent Antonia Hilton sent in this question.
What can be done about vaccine hesitancy among younger Latinos who may not face the same language and technological barriers as older relatives, but may also not be as easily reached by traditional public health campaigns?
Representative Ruiz, this has become one of the latest frontiers of this battle.
Well, we know that to begin with, we are seeing more proportional relative cases in younger individuals because the elderly population have been the priority and they're getting their vaccines. So we're starting to see a shift in the amount and type of individuals that are getting infected. Younger individuals and Generation Z are very in tune with influencers, with social media, TikTok, Instagram, and so I think that it is very important that we create programs with influencers as well as vaccine ambassadors amongst their peers in their schools, in the universities, to go out and encourage the younger individuals to get vaccinated. Look, we just talked about how we all want to get together for the 4th of July and with our families to see our tios, our tias, our abuelos, our grandparents. And your responsibility, your decisions can affect them and others as well. So you don't want to be the carrier that's going to, God forbid, infect your uncle with diabetes and terrible lung disease. You want to make sure that you're protected to get the vaccine so that you don't spread it to others. And that's going to be very important, including recruiting celebrities and others, as the Biden administration is starting to do, to really promote vaccine into the community. But Alicia, one of the misnomers that we have is that the Hispanic population does not want to get vaccinated because of vaccine hesitancy. In fact, overwhelmingly, the reason why vaccines has such dire disparities in vaccination rate is not because of hesitancy, it's because of a neglected system that hasn't worked for Hispanic population and has produced the chronic medical healthcare disparities to begin with.
Dr. Fauci, there is gathering with our families and then there is growing our families. Telemundo anchor Nicole Suarez shared this question.
Pregnant Black and Latino women are 5 times more likely to be exposed to COVID-19. What can health systems do to better protect expectant mothers?
Dr. Fauci?
Yes. You know, a study just recently came out to show that vaccination of pregnant women is quite safe and highly effective. So we're now encouraging pregnant women to get vaccinated. That's important.
Representative Ruiz, this question comes from Luis Valentan, host of Voces Jornaleras and a regional coordinator for the National Day Labor Organizing Network.
Too many of us have been excluded from pandemic aid and from protections at work. We are considered non-persons, like one senator called us. So most of us never stop working. Many did get sick, many died. But President Biden have the authority to grant us with work authorization because we are still working. Where do you stand in this question? Is it time for Biden to take action to recognize our labor and our humanity?
Representative Ruiz, a question there about where this virus, immigration status, work status, all converge.
It all converges in that the Hispanic population has been one of the hardest hit in this pandemic, with the highest infection rates, the highest death rates that our country has seen, because they are mostly composed of the workforce in those high-risk essential jobs, the ones in meatpacking facilities, in the farms, picking our grapes and our citrus and all the other produce that we eat in our foods in the grocery stores. And then they go home, usually to an overcrowded household where there's 3 generations living in sometimes 2 bedrooms, so they can't quarantine, they can't keep their social distance, on top of of a population that has disproportionately high rates of diabetes, asthma, and other chronic illnesses. So you put all that together, and the fact that they live in underserved, under-resourced communities, then you're seeing what we're seeing here. So it's no surprise that Hispanics and immigrants are being affected at a high rate. And yes, we do need to protect all individuals. We need to ensure that everyone has access to safety standards, to the work protection, so they can get tested, so they can get vaccinated. There's been a strong emphasis to ensure that anybody, regardless of their immigration status, should get the vaccines. OSHA is starting to work across government agencies to ensure that industry provides robust protections for their workers. And I do believe in the human right of health and healthcare and the dignity of all of our workers. And that's why labor is so important.
Dr. Fauci, Representative Ruiz, thank you both.